the organization wanted was a stronger impact of research on the advancement of the types of care and the kinds of care that we provided as an organization.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. On February 25th this year, we had the opportunity to sit down with Dr. Thomas Shanley, President and CEO of Lurie Children's Hospital of Chicago. I remember on that day the forecast was for 6 inches of wet snow, which would create a mess for the greater Chicago area. What was not in the forecast was the virus pandemic that we all know too well, COVID-19. The numbers reported in the U.S. jumped from nothing to 100,000 cases in March and then to 1 million cases by the end of April. Recently, we've recorded several podcasts which have been specifically focused on topics related to COVID-19. We can be assured that going forward, there will be further discussion related to COVID-19 based on the lessons we've learned and are still learning. But for now, we're concluding our special edition of the COVID-19 episodes and will return to our broader range of topics. For this podcast, let's look back to the old normal as we interview Dr. Shanley, pre-COVID-19. Today, we welcome Dr. Thomas Shanley, President and CEO of Lurie Children's Hospital of Chicago. If you're not familiar, Lurie Children's offers 70 pediatric subspecialties and has locations across the Chicago area, providing highly specialized care for more than 200,000 children from 48 states and 49 countries. In 2019-2020 U.S. News & World Report rankings of the best children's hospitals, Lurie Children's continues to be the top hospital in Illinois, ranking in all 10 specialties. Welcome to the podcast, Dr. Shanley.
Thank you very much. It's a pleasure to join you today.
Do you mind if I call you Tom?
Not at all.
Okay, well, I'm Bob. And, the history and success of Lurie Children's goes back to 1882, and it has an amazing and rich history. And the previous president and CEO held that position for the past 22 years until December last year with your appointment. So how does it feel to be at the helm of this amazing organization?
Well, I would say it feels extraordinarily privileged to take the reins of an organization that has such a critical mission that many people are dedicated to, has such important responsibilities in terms of being a significant community asset, not just for Chicago and the state of Illinois, but I think increasingly having a national presence. And it's a little, challenging and at times humbling to think about that role and responsibility, especially following someone who dedicated his entire professional life to the organization and led it over the past 2+ decades with such great strength, leaving really a tremendous foundation. So at times a little overwhelming thinking about stepping into those shoes, but having been in the role now for a little over a couple months, really privileged and energized.
Well, I like your approach on here, but quite honestly, you're not a newcomer to the organization. I believe you led the Research Institute for the past 4 years, as well as serving as the chair of pediatrics at Northwestern University's Feinberg School of Medicine. So how does the vision and the strategy move forward now?
Well, I think that was an important decision that the board considered as they thought about the succession planning. And I did join the organization about 4.5 years ago as the department head of pediatrics, where we have approximately about 550 pediatric faculty members full-time as academic physicians and clinicians. And in addition, oversaw the Stanley Manny Children's Research Institute, which houses our entire research enterprise. We can talk a little bit more about how that's composed, but it really spans what we call the translational pillars of research. And in thinking through both of those roles, what the organization wanted was a stronger impact of research on the advancement of the types of care and the kinds of care that we provided as an organization. And they felt by putting a single individual over both of those entities would help begin to bridge and really translate the work between the research enterprise and the clinical enterprise. It also positioned me to work, obviously, with the leadership team because of so many facets of operations that spanned not just the Department of Research Enterprise, but touched the hospital itself. So it did give me a significant opportunity to work with Pat's hospital leadership team for a number of years and became very good partners in our efforts, which included our strategic planning process, now a little over 2 years old or so. And we describe that as our Vision 2025, built around 5 key strategic areas. And we continue to look carefully at whether that serves as a very good guidepost. And I think in doing that exercise, realize that it is directionally the way that we need to go as an organization to have the kind of impact and drive the kind of innovation in pediatric healthcare that we aspire to have, again, not just at the regional level, but at the national level as well. So I think being consistent to that vision is something that the board considered would work well by turning the reins over to someone who had been so intimately involved with that internal process.
Well, you mentioned 5 pillars here in this Vision 2025. What's the top ranking item there?
Yeah, thank you. Thanks for allowing me to expand a little bit on that. And the top ranking priority is providing the best care and experience for our patients and the families. And that's really about achieving the best outcomes, the clinical outcomes that we have across, as you mentioned earlier, 70 of our specialty areas spanning both pediatric medicine as well as surgical activities in child health. And it's really important. We focus on being a data-driven organization where we look at where our current performance is as we compare to our peers and driving to the best outcomes. And when we're not at that best outcome, we like to implement evidence-based best practices to move the dial from where we currently are as an organization to where the very best institutions are at this point in time. Now, in many of the things we do, the U.S. News and World Report, as an example, ranks 10 of the pediatric subspecialties. And in 6 of those domains, we are at the best or exceeding and therefore leading in outcomes in those domains. In the other areas, we know that we've got some work to do. And we do that work, again, by implementing best practices. But it does then dovetail into the second area of advancing pediatric medicine and science. And that's fundamentally about investing in and growing the impact of our research enterprise to really advance outcomes to the ideal state that we can achieve. So big focus on that and educating our workforce as part of that domain.
Yes, I agree.
Yeah, both of those things are really hard. It's hard work. It's important work, and it's really good work to advance what we do for kids, but it's hard work. And so making sure that we're an employer of choice is the third domain. And I've been trying to encourage people to think not just about the outcomes that we drive for as providers, but the outcomes that we're all responsible for in our individual operations, whether they directly impact our patient care and our family's experience or indirectly impact them. And so I continue to challenge people to think about where they have opportunities within their component of the organization to ramp up their operations and then innovate in the spaces that we allow them to experiment in. And in doing so, hoping to create a culture of psychological safety where people are feeling comfortable about bringing forward opportunities for improving what we do and being creative and innovative in potential solutions to address those and not being afraid to fail as well in being innovative from that aspect. The fourth area is just our growth strategies. We certainly know that the market continues to have demand on desiring to be seen and cared for by a Lurie provider. And we want to make sure that we're able to grow out into the community in a way that allows us to meet those needs where we can treat the patient with the best care and the best experience in the best place for them. And the last piece is just to make sure that we we're able to continue to maintain this mission and vision by maintaining our fiscal strength. And there's certainly a lot of external pressures that continue to put challenges on that, but being good stewards of our resources, trying to be very cost efficient with our operations, and really value driven in our care model, which is providing the highest quality of care at the lowest cost that we can do so, is part of the philosophy and the principles that we abide by.
Well, I know that philanthropy has been a key component of your success as well. And I think it was in 2012, your footprint in Chicago really changed and expanded. I think you moved from the upper Lincoln Park area, really close to the location down at Northwestern University. That was a big move for the organization, wasn't it?
It certainly was, and you're absolutely right that the campaign for kids was a key philanthropic effort to make sure that we had the resources to be able to move into these facilities and provide the type of complex care that only a site like ours can, with the types of teams that we've been able to put together. The proximity to the rest of an academic partner, in our case, Northwestern University and the medical school, the Feinberg School of Medicine, has been an opportunity for us to have greater relationships across the pillars of our academic entities. And so those pillars include our clinical care, obviously, and we do a lot of partnership as it relates to transitional care. So we know as children become adolescents and young adults, they need to transition that care to adult providers. So opportunities to partner there. Certainly, it's really been transformative with the research enterprise, being able to bring investigators in and have a critical mass of scientists that are working on related themes that really advance the types of questions that we can ask and the types of partnerships that we can build as it relates to some of the grant activities. And that really was also buoyed by our current campaign effort towards our research enterprise, which was a key component of us moving the Manny Research Institute from Lincoln Park also down onto Streeterville, now very proximal to our hospital, in the Simpson Query Biomedical Research Center, where we have 4 floors within that research center, sharing the space overall with our partners at the Feinberg School of Medicine. So those two moves have been quite transformative. And you mentioned the move back in 2012, and that was a time of significant change for many people in the organization. And now, as we sit here in 2020 with a significant change, as we talked about earlier at the leadership level with the president and CEO, we're kind of reframing for folks what it means in terms of the expectations of change in our healthcare systems and what we're aiming to do. So we're kind of refreshing for our staff some change management strategies as we think about what we do from an HR system to support them through many of these changes coming up.
Well, since you are both a clinician and a scientist, that certainly fits well into your domain, I would think. And I'd like to digress just for a moment back to some of these specialties, because I know that one of the highest ranking specialties that you have is in the cardiology. And here at the University of Texas, Dallas, we have a program which is called the Alliance for Physician Leadership. And we bring in top physician leaders from around the country. And quite honestly, one of our best students, I found out, Dr. Bradley Marino, is one of your best doctors as well in the cardiology group.
Absolutely. Brad has been a stalwart leader in our heart center, and most notably leading some of the work in our post-cardiac surgical care unit, our cardiac ICU, but also importantly as the director of our cardiovascular research program within the heart center itself. And he has been a real pioneer throughout his own personal research career in understanding the very important implications on neurodevelopmental outcomes after children who have to undergo heart surgeries for congenital heart disease, and has helped us build that important framework of follow-up, which has actually scaled across obviously other important areas of pediatric medicine in which children's brains could be affected by things that we do for them or things that happen to them, for example, being born significant prematurely. So a real partner that has opportunities to have an impact across a number of domains, even beyond cardiovascular surgery. Dr. Marino is a terrific example of much of the terrific talent that has been recruited in over time in the Heart Center, including, Joe Forbes as one of our neonatal heart surgeon specialists, Paul Tanous as one of the interventionalists, and then really Alan Nugent, one of our second more senior interventionalists. That team that does amazing things with catheters in children is probably among the strongest teams, frankly, in the world. And in addition, you require a very strong cardiac anesthesia team to support kids that are going through heart surgeries and heart transplantation, another exceptional program where we're going to close the year or close the calendar year of 2019 as the leading pediatric heart transplant center in the country. So that's been certainly one of our highlights of our organization. And, one of the areas where we hold the example up to our other programs of the type of excellence that we want to deliver across everything that we do with kids.
I know Dr. Marino has shared with me the intense collaboration between the different groups and how that makes such a huge difference in the value that's created and the efficiency that's created, and how predictably you can do these incredible treatments for these children before they're born and up through adolescence. I mean, they follow them the entire way. And that's just a unique situation, I think.
Very much so.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
Leveraging key personnel, genomics research, is that a new area that you're trying to ramp up into as well?
I wouldn't say it's a new area, but I would say it's been an area of priority and an area where upon my arrival, I thought that we had opportunities to get stronger in. We understand, since the genomic era has exploded, that there are so many molecular tools available to researchers that can partner with clinicians to really begin to better understand disease causes, can understand disease risk factors, and can try to develop sort of predictive algorithms by which we can then think about more proactively and prescriptively precise therapies and precise cares. So that usually falls under this domain of what's called precision medicine. And as we did our strategic planning process a few years back, 2 of the key areas where we felt we had great strength and opportunities to really advance care was in our oncology program, as well as in our neurosciences, and in particular, our epilepsy program. What we lacked were some broader strengths within our research enterprise, utilizing genomic investigation to really garner new insight to mechanisms of diseases, which would then subsequently inform new therapies. And so our successful recruitment a few months back of Dr. Nico Katsanis, who's a PhD investigator who moved his research program from Duke University to join the Stanley Manny Children's Research Institute and direct our molecular genetics program. And I think one of the things he was attracted to with this opportunity was not just great new facilities in terms of the Simpson query structure, great partnerships with the molecular genetic folks in the medical school, but in addition, a great deal of clinical substrate and clinical patients to study as we tried to discern what some of the genes around their disease-causing mechanisms were. So that's been a very big investment. We're now in the process of recruiting a division leader for our clinical division of genetics to really partner with Dr. Katsanis. And I think as we continue to build these platforms of utilizing DNA information about understanding children's health, it will give us an opportunity to be quite innovative and transformative in developing new approaches.
Is Lurie Children's, is it a teaching hospital per se? Would you consider yourself to be a teaching hospital?
Oh, very much so. I think among one of the stronger pediatric training facilities really in the country. So we have, I would say, several levels of teaching. If we start with the MD, medical doctor pathway, we're the teaching facility for the medical students. So the pediatric learning that the Feinberg School of Medicine students get is through Lurie Children's. When you finish medical school and you decide to go into pediatrics, that's entering your residency program, a 3-year training program, and we have a very competitive program. And one of the very few, when you complete the program in order to care for kids and get licensed by the American Board of Pediatrics, you have to pass your pediatric board examination. And we're quite proud that over nearly a decade now, I believe we're up to 8 years in a row, every single resident that has completed our training program for 3 years has passed that board exam. We're one of the very few programs in the country that can tout that. And then if you decide to subspecialize into an area in pediatrics, we have a number of fellowship programs in each of those specialties, neonatology, cardiology as examples of those. And I'm quite proud of the growth of each of those programs that we've had and the kinds of quality of candidates that we've recruited into those programs, which each year have become increasingly competitive as we really compete for this talent pool with the very best programs, those top 10 programs that we aspire to count ourselves among and are privileged to count ourselves among for this young talent group. So that's the MD pathway, but we also provide training for physician assistants. We have a number of nursing training programs. We have respiratory therapy programs. We even have many of the high school programs where we reach into the community and be able to provide summer internship and other programs to try to bring more of the workforce from the neighborhoods and the communities that we also serve. So we are a extraordinarily broad teaching institution with a number of responsibilities. And those are really just the internal programs. We obviously, a number of folks around the area count on us to be able to provide some unique experiences and exposures to populations like transplants and others that they don't have access to elsewhere.
Well, you mentioned your outreach to the community. I know that's a topic that is of great importance to you, and you're becoming a hospital without walls. I think you've got, 5 primary care centers, a lot of outpatient centers. If you would, share your view on the importance of collaboration and innovation with the community and the community leaders.
Well, if you'll give me a few minutes of personal perspective on that, my personal background is as an ICU physician, so I'm worked in the pediatric intensive care unit, and as you mentioned, my research background really was in large part early on focused in the laboratory where I did cell work and animal experiment work with trying to understand what happens to kids with severe infections. So your question is, how does an ICU guy that's a mouse researcher become someone who puts so much importance in terms of reaching into the community? It was really a privileged opportunity that was given to me in my last professional stop at the University of Michigan, where I ran what was called the Michigan Institute for Clinical and Health Research, which was responsible for executing on what's called translational research, again, spanning from the bench out into the bedside. But part of my responsibilities in directing that institute was to develop and run community engaged and community facing research activities, because that's really the final component of getting an impact of improving health and really getting health promoted in the community is necessary to do. And that was a lesson that I had to learn. And but I came to understand how incredibly valuable and necessary it is for us to get to our full vision of aspirations, which is to really move kids who need us from a tertiary and quaternary care and a super subspecialty care to trying to get much more upstream into the community where they are not only getting primary care, and we want to aim to really disrupt that to be from a few face-to-face encounters per year experience to something that is really almost continuous. And then also thinking about, kids spend most of their time at home or at school or in community-based organization activities. And if we really truly want to aspire to get them to adulthood with zero health risk factors and get them to be educated, because you need to be healthy to be educated, and be very productive adult citizens for our communities, we should be prioritizing a focus on how to leverage those environments to really drive them to making the best health promoting decisions and ensuring that we're doing the best health preventative strategies. And again, potentially even in a very predictive manner, based on the understanding that both their genes as well as their social influencers, we'll get back to that in a second, that are really defined perhaps by their zip code.
Yes, for sure.
Yeah. And so we do have a saying, we embrace the saying around here that we do understand that your genetic code is as important as your zip code in influencing what your health trajectory and health outcome should be. And so I will just get back to that. We don't call them social determinants of health here. We're really trying to change the narrative where people, that would imply that these situations are deterministic of what your outcome is going to be. And we recognize that they do influence it, but we're not as deterministic. We believe that we can change the approach and really transform the model of community care and primary care so that we optimize what the trajectory of health outcome and the access of resiliency and other things that we know are so critical to get kids into optimal health as young adults.
I really like your new terminology. I think everybody should start to embrace that. And I know that, you have a role now as a servant leader. You'll have town hall meetings. You have the opportunity to solicit feedback and work with the community in a wonderful way. And I've got to tell you, it's just been a great pleasure here this afternoon to be able to talk to you about what you're doing in your new role. We see all the time when we talk to different people in the healthcare world that the future of science and medicine and healthcare delivery, it's changing all the time. But talking to you, Tom, I really get the sense that putting children and their families first, that's never going to change at Lurie Children's. I think that's an incredible opportunity you have here to advance the cause in a pretty wonderful way. So I want to thank you today for being part of our program.
Bob, it was truly my pleasure, and yes, patients and their families will always remain first in our mind, and we always remain committed to our legacy of treating any child that walks into our doors and feel privileged to be able to have this role in our community, and really appreciate the support that we get. And again, thank you for the opportunity to share some thoughts with you this afternoon.
We'll continue to follow you and stay in touch. This is a really exciting proposition you have on the table. Thank you.
Thank you, Bob.
Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.